What if there's a quiet danger hiding inside you and you don't know it until it's too late? Imagine this. A tricky enemy, sneaky and hidden, that could affect nearly 5 out of 100 Americans in their lifetime. This is the truth about colon and colorectal cancers. These two types of cancer are often known for being sneaky. At their beginning stages, these diseases might not show any signs. They quietly get worse until they become harder to fight. But knowing more can help us. Knowing the possible warning signs and risks can help us stay safe from these quiet dangers. It's about noticing small changes in our bodies and knowing when to talk to a doctor. It's about giving ourselves the right knowledge to make smart choices about our health. So, get ready to learn about colon and colorectal cancers. Keep watching to discover the 10 signs of these quiet dangers and find out if you might be at risk. Before we dig deeper, let's get clear on what colon and colorectal cancers are. These are serious sicknesses that start in your colon, the first part of your large intestine. They often start as small, harmless lumps of cells called polyps. Over time, some of these can turn into colon or colorectal cancers. More people have these cancers than you might guess. About 1 in every 20 Americans will get colorectal cancer in their lifetime. This means it could affect someone you know. One tricky thing about these cancers is that they often don't show symptoms early on. This means they can get worse without you noticing until they are at a more dangerous stage. Also, early signs of colon cancer can be mistaken for less serious problems. That's why it's so important to see a doctor if you notice anything strange with your body. Regular checkups can find these cancers early. These checkups can spot polyps before they become cancer. This greatly improves the chances of successful treatment. Regular checkups can't be stressed enough, as they are the best way to protect against these cancers. There are several things that can increase your risk of getting colon cancer. These include things like your diet and how much you exercise, as well as your family history. But just because you have a risk factor doesn't mean you will get the disease, and not everyone with the disease has known risk factors. Now that you know a little about these cancers, let's look at the 10 warning signs. So, what should you be watching for? Here are 5 things to look out for. Notice changes in your trips to the bathroom. This could be anything from loose stools, hard stools, or a change in your poop that lasts more than 4 weeks. We might not like talking about it, but it's important to pay attention to these changes. Second, look out for stomach discomfort. This could show up as frequent gas pains, feeling bloated, a sense of fullness, or cramps. These symptoms could be for many reasons, but if they keep coming back, don't ignore them. Then, there's unexplained weight loss. If you're losing weight without changing what you eat or how much you move, it could be worrying. It's normal to lose or gain a few pounds now and then, but big, unplanned weight loss could be a sign of a serious problem like colon cancer. Fourth, watch out for feeling tired or weak all the time. It's normal to feel tired after a long day or after working out hard. But if you're feeling always tired or weak, even when you rest a lot, it might be time to talk to your doctor. Lastly, look out for iron deficiency anemia. This condition could show up with signs like looking pale, feeling tired all the time, and being short of breath. It's because of not having enough red blood cells to carry oxygen around your body, which could be because of bleeding in the colon. But that's not all. There are more signs to look out for. The next parts are just as important, maybe even more. Let's dive into them. The 6th red flag is finding blood in your poop. This might mean there's bleeding somewhere in your gut, and even though other things can cause it, it's important not to overlook this sign. Always call a doctor if you see this change. Next up, the 7th red flag is always feeling like you need to poop, even right after you just did. This could mean something's wrong in your large intestine. It's your body's way of saying you need a checkup. Now let's talk about the 8th sign, feeling sick or throwing up for no clear reason. While many things can cause these symptoms, if you're constantly feeling sick or throwing up, it could be linked to colon cancer, especially if you're also seeing other signs we've talked about. The 9th sign is a condition called jaundice, which makes your skin or eyes look yellow. This could mean that colon cancer has reached your liver. Jaundice usually means something serious is happening, so you need to get medical help right away. Lastly, the 10th red flag is suddenly developing constipation or diarrhea. Changes in the way you poop that last more than a few days could mean a growth is blocking your large intestine. It's vital to pay attention to your body and remember any big changes in your poop. Remember, these signs don't mean for sure that you have colon or rectal cancer. They could also be signs of other, less serious problems. But catching cancer early is really important, and knowing these signs could even save your life. Now that know the signs, it's time to think about your risk. Scene script. Could you be at risk of colon or colorectal cancer? Let's see. Just like most health problems, some things can make it more likely to get colon and colorectal cancers. Your age is one of them. Most people found with these cancers are over 50, but that doesn't mean young people can't get it. Knowing about your family's health history is key, as your genes can have a big part. If your mom, dad, brother, sister, or child has had these cancers, you might be at a higher risk. But it's not just about age and genes. The way you live and what you eat can also add to your risk. Eating too much red or processed meat and not enough fruits, vegetables, and whole grains may add to the chances of getting these cancers. Drinking too much alcohol and using tobacco are also risky. Being overweight and not moving enough are other risks. Being active and keeping a healthy weight can not only lower your risk of colon and colorectal cancers, but also keep you healthy overall. Now, having these risk factors doesn't mean you'll surely get these cancers, but they're important to think about. Regular tests can find growths before they become cancerous, making early finding really important. Sure, no one likes getting tested, but think about it this way. A little discomfort now could save you from a big problem later. Remember, these cancers might not show signs in the early stages, making regular tests even more important. It's always better to stop something from happening than to deal with it later, and in this case, stopping it starts with knowing about it. Knowing is power. Use what you know to take charge of your health. Your well-being is up to you. This is a fact we've talked about today. We've focused on the quiet dangers of colon colorectal cancers. We've explained the signs, shining a light on symptoms might not notice. Knowing these signs is very important. It's the first move in finding the disease early. Remember, about 5% of Americans will get colorectal cancer in their life. It's often found late when treating it gets hard. This is why having regular tests is so important. These tests find growths before they turn into cancer. If you've noticed any of the signs we've talked about, you should talk to a doctor. The aim isn't to scare you, but to make you aware. It's about taking care of your health and making smart choices. You don't have to go through this alone. Talk to a doctor, share your worries, and if needed, schedule a test. Don't ignore the quiet danger. Act now and stay ahead of colon and colorectal cancers.